Hey everybody, this video is going to be an introduction to the non-stress test, or NST, that a lot of pregnant women undergo just to see. It's kind of an indicator of the fetal well-being. It's a key part of what's called the biophysical profile, a BPP test. Basically, you're checking to see if the baby, the fetus rather, is reactive or non-reactive. Those are kind of the big buzzwords. And the essence of this test is you go into your doctor's office, they set you up. Usually you're either in the supine, which means you're laying down on your back, or you're in the lateral decubitus on your left side. Some people say that, because you have this big mass growing on your belly, your fetus, that if you lay on your back for too long, that weight can kind of depress like the inferior vena cava, or can cause hypotension or poor blood return to the heart, venous return to the heart. So they have you lay on your left side because you're going to be there for a while, up 20 minutes, which is longer than your typical OB appointment in its entirety. So you're laying there on your left side. They're going to put these elastic bands with these like sensors on your belly, and usually like blue and pink or some sort of baby-friendly colors. One of those is a Doppler ultrasound, or a Doppler machine that's just like when we listen to the fetal heart tones, and it goes, there's that little machine and it goes. That's essentially what one of those is, just in a different form. And then the other one of those elastic bands is going to be called like a tokometer or tokodynamometer. It essentially is watching your belly or your uterus for contractions. So one of those straps is watching the fetal heart rate. The other one is watching you for contractions to see if you're contracting. And you use kind of the same setup for like a contraction stress test, but we're not talking about that in this video. We're talking about a non-stress test. So what does non-stress test mean? Well, it means that we're not stressing the baby out, as opposed to that contraction stress test I just talked about, where they actually make you contract and see how the baby does with it, or see how the baby's responding to contractions. Non-stress test, we want it to be just like you are hanging out on the couch, and we're seeing how reactive the baby is. A baby's heart should be reactive to external stimuli. And pregnant mothers you hear them talk about this all the time, like, oh man, he's really awake at night from 6 to 10 p.m. or he's really awake, talking about their fetus. My fetus, she's really awake from 6 to 10 in the morning, or something like that. And there are, the baby, it does wake up. It has cycles. It does wake up at certain times of the day. It's more active. Certain things can set the baby off, like drinking cold water or external stimuli. Sometimes for these tests, these non-stress tests, they use external stimuli like a pen light, or a light is placed in the abdomen, because the baby can sense that in its cavity. Sometimes they talk about like acoustic, like they play a noise to wake the baby up, playing music, that sort of thing. So in any case, although we are kind of stimulating the baby just to wake it up, we're not doing a contraction or a stress test. This is a non-stress test. So this should just be like you are at home, hanging out on the couch, and we're just seeing how reactive the baby's heart is. Okay, so I drew two lines up here, and this is kind of what you see as the printout of a non-stress test. And this isn't a real scenario, so I just kind of drew some lines up there. But the two lines, which will constantly be going, right? There's going to be a pen on each one of these lines that's like writing what's going on for the full 20 minutes of your non-stress test. And the bottom one is the tokodynamometer. This is just showing contractions. So if you had a contraction, like if you were in labor, this thing would just go like up off the chart even. Like it would just be huge. Or, if you had a minor contraction, it might just be like a little bump here. But for the most part, in a non-stress test, this should just be like a straight across line, right? If you're not contracting, if there's nothing really going on, this should just kind of be your muscles just hanging out. The tokodynamometer is going to be looking for anything it can pick up as a contraction, but this is a non-stress test. You should be pretty relaxed. This top line is going to be fetal heart rate, FHR. And this is going to have beats per minute. So just like when you take your pulse, and you're like, oh, I'm at 70 right now with my pulse, the fetus has a pulse, and typically its pulse is a lot higher, like 130 to 170. And so this is going to be measuring what the baby's heart rate's doing. This is essentially that Doppler strap around your belly, and this is that other strap around your belly. So this strap's going to be watching the fetal heart rate. And now, what does a reactive heart rate mean? Well, by definition, it means 2 accelerations in heart rate that are greater than 15 beats per minute for at least 15 seconds. Okay, so now let's break that down, right? I'm just going to erase this line. And let's break it down. What does it mean to have a reactive heart rate? So, non-reactive, maybe that'd be the easiest way to start. Non-reactive would be the baby's heart's beating, but it's just beating. There's no change. No, you're there for 20 minutes, and that baby's heart rate was at like 120 the entire time, never changed. That's non-reactive, right? I mean, just think about that word non-reactive. It's not reacting to anything. It's just hanging out there at 120. Now, reactive is, again, true accelerations that are greater than 15 beats per minute. So let's just draw like some lines here. And let's say this is 130, and this is 140, 50, 60, 70. And you go in there, and your baby's happy at 130, and then what this means is twice it has to spike up greater than 15. So 15 would be here. Let's say it spikes up here to like 160, and it stays there for 20 seconds, and then it comes back down. And that's not bad. Nothing's going on. The baby's just readjusting, just being reactive, just reacting to stimuli like lights or sounds or spicy foods or cold water or, you getting up and moving. And then what we want to see is we want to see another one of those greater than 15 beats per minute for 15 seconds. And if you see two accelerations like this, these are called accelerations because we went from 130 and we accelerated to 165, and then we decelerated back down. Then we accelerated again to, whatever, 150 or 155 or something. We want to see at least two of these accelerations, these little peaks in fetal heart rate. We want to see two of them that are greater than 15 beats per minute, so kind of tall here, and each one has to last for more than 15 seconds. I know it's kind of a mouthful, but two accelerations greater than 15 beats per minute that last for at least 15 seconds each. And that, if you saw this, and usually with a fetus, you'll see quite a few, or not quite a few, but more than two accelerations like that. That is a sign of a reactive, reassuring fetal heart rate strip, and that's what you want to see. You want to see a reactive thing. If it is non-reactive, if it's just like this and nothing changes, that it really just means you got to do some more tests and see why that fetus isn't more reactive or more responsive. And like I said, this non-stress test, it's really chill. You just go in, you lay there with two bands around your belly for 20 minutes on your left side. You can bring a magazine or whatever. It's part of a larger test known as a biophysical profile, or BPP. It's one of the 5 sections of that test. And so that's really what it is. It's just a diagnostic way of trying to let you know how well your fetus is doing, if they're reactive, non-reactive, or what's going on with them. Thanks.